Hello everyone. Thank you for choosing to watch this video. I am Dr. Pallavi Kalghatgi and I am a senior IVF consultant and fertility specialist at Zenith Advanced Fertility Center in Pune. Today's topic is very important to me because it hits directly to women's health and well-being. It's not only the awareness or the knowledge or the information, but it's also the responsibility of one's body that is a major part of women's health and well-being. Which brings me to today's topic, that is on contraception or birth control. I've come across so many young women that have recently become sexually active but are so unaware of the concept of contraception. And it is deeply disturbing to realize this lack of awareness. But I think this isn't really only lack of awareness, but it is the misbelief that by talking about contraception or talking about sex education, we are actually encouraging sexual behavior among the youth or the unmarried. The truth is, it is happening anyway. So why not become more responsible? Why not give the awareness and explain and talk to the young women about their sexual journey, their sexual desires, and give them the appropriate treatment or the appropriate knowledge about sexual health? That is a much more responsible thing to do, isn't it? So that is why we are going to be talking about contraception today. Basically, who all need contraception, what is contraception exactly, why do we need it, and of course the various types of contraception that are available. So let us talk about the fertile period first. What are we talking about? What is the primary goal of a contraception? So you all know that the fertile window in a normal menstrual cycle, that is of 28 days, the fertile window is usually the mid-cycle period. That is, say, somewhere between day 12 to day 18 of your menstrual cycle. During this time, the process of ovulation is also occurring. That is, the egg is released and it is waiting at the fallopian tube. Now, what is it waiting for? It is waiting for the sperms to come and travel and reach it and fertilize it. So this entire process is actually making your body favorable for a pregnancy. So your endometrium, your entire reproductive part of your body is becoming favorable, encouraging the environment for a pregnancy. What does a contraception do? A contraception is basically trying to create a barrier from the sperm to meet the egg, or it is creating the environment unfavorable for a pregnancy. So when I say pregnancy, I mean the process of fertilization, the process of implantation. So the contraception is basically making small changes in the body which is making it unfavorable or unsuitable for the process of fertilization, implantation, sperm meets egg, all this unfavorable, and that is how it is preventing the pregnancy. Now there are various kinds of contraceptions available, and that is a good thing because as women during our reproductive life, our need for contraception can change from time to time. The type of contraception that is to be used keeps changing based on the needs of the woman. I will be talking about each type of contraception in detail in my following videos. So that's how it becomes like a contraception series, and in each part I will be discussing about the contraceptions that are available, the benefits, the way that it helps, the kind of women that are going to be benefited by that particular contraception, and so on. Now the next question is, who all need contraception? The answer is very simple. Any couple who are sexually active, a woman who is menstruating regularly, requires a kind of contraception whatsoever. Now, the next question will be that I have intercourse during the safe period of my menstrual cycle. Now, first and foremost, this kind of contraception used to be used before when the awareness was not so much. But the truth is that safe period is, and there are many, of course, there are many apps and many calculators that are determining the safe period of your menstrual cycle, and usually it is assumed to be the first 7 days and the last 7 days of your menstrual cycle. But nowadays, with the increase in the the menstrual irregularities or the menstrual issues that women are facing or young girls are facing, it is very difficult to determine the safe period of your cycle. Basically, the safe period is just the time period that I spoke about before, the fertile window. It is the exact opposite of that, which can be considered as the safe period. But the fertile window itself is shifted from time to time in a menstrual cycle, especially now, because the incidence of irregular cycles or PCOD or thyroid disorders are increasing so much in young women that this fertile window tends to change from time to time. So that is why the safe period method of contraception, which is a natural method, cannot be a reliable one. The next common idea that young women have is that I'm having sex only for the first time, so I cannot get pregnant. Well, that is again not true. Whether you're having sex for the first time or the second time or the third time, if you are in the fertile period, or if you are a normal menstruating woman and are unaware of your fertile window or are unaware of your cycles in general, you do not know whether you can get pregnant or no. So it is always better to have or to use a contraception. Another common thing that most couples do, especially when they are in the initial phases, recently started to have intercourse, is that the man ejaculates outside. This is still considered as a natural method of contraception, where just before the man ejaculates or orgasms, he will ejaculate outside. In that way, the sperms will not get deposited in the vagina and they have no access to travel to the egg. But again, the logic here is that sometimes the ejaculation would have already started as he exits out, and at that time some sperms can get deposited into the vagina and they can also cause a pregnancy. Again, the pre-ejaculatory secretions that are present also may contain small amount of sperms, and they can also get deposited in the vagina and can end up reaching the egg. Another important question that many of young women ask is that, is having intercourse during your period safe? Well, it is not, again, it is not 100% safe. It is the chances of having a pregnancy if you have intercourse during your period is definitely low, but it is not zero. So when something is not foolproof, you cannot trust when what can happen, right? You don't know whether you're having regular cycles. You don't, especially if you are a woman who tends to have irregular cycles, periods every 15 days or periods for with a gap of 3 months, you do not know when you are ovulating, and in that case sex during your periods is again unsafe. A lot of women also feel that I have PCOS. So if I have PCOS, according to all the data that they have collected online, they think that the ovulation is hampered in PCOS. So ideally I should not ovulate, so I do not need a contraception. That is not true. If you have PCOS, you may not necessarily have irregular periods and you may not necessarily have anovulatory cycles. There are various aspects to PCOS. PCOS or PCOD is definitely a cause for infertility, but not all women who have PCOD are considered infertile. So even when you have PCOS, you will need a mode of contraception. You cannot assume that every time you have intercourse is a safe period. That is not right, and that is why you need to get evaluated first before considering which kind of contraception should you require. Also, post delivery. Now, post delivery, a woman is usually breastfeeding. It takes some time during the period where she's breastfeeding. There is a time frame where she does not get her period. That is usually 6 months, and that is called lactational amenorrhea. That is considered a natural method of contraception, but that may last only for about 5 to 6 months. After that, your fertility comes back to normal, irrespective of whether you get your periods or no. So even post delivery, you must consider an appropriate contraception, especially because you do not want an accidental pregnancy when you have just delivered, because that means you have not spaced out your pregnancies well. Now, there are many drawbacks to this, because usually in the post pregnancy period, your body is kind of recovering from all the events that have occurred during pregnancy and delivery, which includes that during delivery you have some amount of blood loss as well. Blood levels in the body have to recover before you can even consider the next pregnancy, especially because that pregnancy may end up becoming you may end up having complications. You may end up having low hemoglobin. The growth of the consecutive pregnancy may not proper in the baby if you have not spaced out your pregnancies well. So post delivery contraception is also very, very important. The next question is, what about sex during pregnancy? Well, I think that is very straightforward. You're already pregnant, so there is no logic behind it. But of course, sex during pregnancy is something that you have to discuss with your doctor, because if you have had recent episodes of bleeding or pain in abdomen or some kind of discharge, you have to get evaluated before you consider intercourse during pregnancy. And what about contraception for an older couple? You may think it's not required, especially because many women think that I've almost reached 40 now and I probably don't have any eggs left and the quality must be so poor. And a man may think that I'm also old and my sperms would not be so active as they were. Well, that is not true. In males, the sperms remain active up to the age of 65-70. They actually work. And also in women, even though your quality or the quantity of your eggs would have reduced, it does not mean that gives you a zero chance of becoming pregnant. Especially in your perimenopausal group, where you're just about to hit menopause, so that the perimenopausal group can last from almost a year to 3 years, and during this time you may experience irregular periods, or you'll experience period only once a year. But till you actually hit menopause, that is complete absence of periods for a year or more, that is what you define as menopause. So till you actually reach menopause, you can still get pregnant, because you don't know if you're ovulating, if you don't know at that particular cycle if you have ovulated. So again, considering contraception even for an older couple is very important. So you must be getting an idea as to the different age group of people that are actually going to benefit by using contraception and by avoiding an unwanted pregnancy. That is why the availability of contraception, the different types of contraception available are also vast. And it is very important to understand that before you even consider to start a contraception, please always speak to your doctor or your gynecologist, consult them, talk about your if you have any existing medical conditions, what kind of contraception is beneficial, what is your plan for a family in the future. Based on all of these factors, an appropriate contraception will be decided with your doctor. Another important point is to understand that birth control will never cause infertility. So many of these young couples who have recently gotten married and of course do not want a pregnancy or do not want to plan for a family immediately are scared to take or to use a contraception. Basically, they feel that by using OC pills or by using a long term contraception, they may end up landing up in infertility. That is not true. If the moment you stop using that contraception or the moment you eliminate the contraception, your fertility will come back to normal. Unless you already have a pre-existing cause for infertility, contraception per se will not cause infertility. So that is a very important point young couples must understand. Birth control will not cause infertility. So that was about today's topic. A talk on each contraception is going to come in the consecutive videos. So please stay tuned. If you ever have a doubt as to anything related to your reproductive health, your sexual health, you have any issues during your sexual journey, please feel free to contact your doctor and speak to them openly to take care of the problem. Thank you.